Welcome to the last part of our lecture series on hepatitis, and we are going to discuss hepatitis E infection. I am Dr. Teke Apalata, a clinical microbiologist. So let's start. Hepatitis E infection. So what do we say about hepatitis E? Hepatitis E is a liver disease that's caused by the hepatitis E virus. And this virus has at least 4 different genotypes. We have genotype 1, 2, 3, and 4. And genotype 1 and 2 have been found only in humans, but genotype 3 and 4 circulate in several animals without causing any disease, or maybe occasionally infecting humans. But what we found more common causing infections in humans are genotype 1 and 2. So the virus is shed in the stools of infected people, and it then enters the human body through the intestine, the GIT. So it is transmitted mainly through contaminated drinking water. And usually the infection is self-limiting and it resolves within 2 to 6 weeks. So it's only occasionally that it can cause serious diseases that we call fulminant hepatitis. That is acute. It can cause an acute liver failure that will develop. And those are then the people who might be admitted, and sometimes they die from this infection. So this is the structure of the virus. Now, in terms of transmission, hepatitis E is transmitted mainly through the fecal-oral route due to fecal contamination of drinking water mainly. So this route accounts for a very large proportion of clinical cases with this condition. And the risk factors for hepatitis E are actually related to poor sanitation, allowing virus excreted in the feces of infected people to reach drinking water supplies. You know, it's actually found in countries with really very poor sanitation. And other routes of transmission have been identified, but appear to account for a much smaller number of clinical cases. Those routes of transmission might include ingestion of undercooked meat or meat products derived mainly from infected animals like pork liver, but it's very rare. Transfusion of infected blood products, it's extremely rare. Vertical transmission from a pregnant woman to her baby, it's also extremely rare. So what are the epidemiological features associated with hepatitis E? Most outbreaks are associated with fecally contaminated drinking water. And this has been the most critical route of transmission. Several other large epidemics have occurred since in the Indian subcontinent and China and Soviet Union and Africa and Mexico. That's where we have been large outbreak associated with hepatitis E infection. In the US and other non-endemic areas where outbreak of hepatitis E have not been documented to occur, a low prevalence of anti-hepatitis E virus, antibodies has been found in healthy population. So we have been found that some people, less than 2%, can have antibodies anti-hepatitis E. So the source of infection for those persons is unknown. So there is a there is an hypothesis of minimal person-to-person transmission, but it's not well documented. Hepatitis E is found worldwide, but the disease is most common in East and South Asia. Every year, there are an estimated 20 million hepatitis E infection worldwide, leading to an estimated 3.3 million symptomatic cases of hepatitis E. And the World Health Organization estimates that hepatitis E caused 44,000 deaths in 2015. You know, this accounted for almost 3.3% of the mortality due to the total viral hepatitis cases. In terms of clinical features of this infection, the incubation period is 40 days in average, ranging from 15 to 60 days. And the case fatality rate is found between 1 to 3% in the general population, but the most of the worst affected people can be pregnant women, where the case fatality rate can range between 15 to 25%. The severity, illness severity increases with age, and the chronic sequelae has not been identified. Hepatitis E, it's just like hepatitis A, it does not typically progress toward chronic infection, but you can develop a severe acute infection that will lead to acute liver failure. That's what we call fulminant hepatitis. What are the typical signs and symptoms of this condition? During the initial phase, the patient will develop a mild fever and reduced appetite, what we call anorexia. He will have nausea and vomiting lasting for a few days. Some person may also have abdominal pain, or sometimes skin rash, or or joint pain, during the initial phase. Then there will be the second phase, that's what we call the jaundice phase, where there is a yellow color of the skin and whiteness of the eyes. So with dark urine and pale stools. So you can see that the liver is slightly enlarged and tender. That's what we call hepatomegaly, that the patient might develop. So these symptoms are often indistinguishable from those experienced during other liver illnesses, and they might last for 1 to 6 weeks, okay? So you cannot really differentiate those from other hepatitis. So in rare cases, acute hepatitis E can be severe, that's what I said already, leading to what we call fulminant hepatitis. That is actually acute liver failure. And those are the patients that are at risk of death. So fulminant hepatitis occurs more frequently when hepatitis E occurs during pregnancy. So this is a major problem with 25 to case fatality rate between 25 to 35% of pregnant women. So pregnant women with hepatitis E, particularly those in the second or third trimester, are at increased risk of acute liver failure, fetal loss, and mortality. So it is a serious condition among pregnant women. Up to 20 to 25% of pregnant women can die if they get hepatitis E, especially in the third trimester. So it is a very big problem. Cases of chronic hepatitis E infection have been reported in immunosuppressed people, particularly people who receive organ transplant recipients, on immunosuppressive people on immunosuppressive drugs, and also those who are infected with genotype 3 or 4 hepatitis E infections. Okay, so those have been shown to develop chronic infection, people who are immunosuppressed, organ transplant recipient, immunosuppressive drugs, and also those who are infected with genotype 3 and 4. Remember, genotype 1 and 2, it's commonly found among humans, and 3 and 4 are mainly circulating among animals. So the diagnosis, cases of hepatitis E are not clinically distinguishable from other types of acute viral hepatitis. That's what I said. However, the diagnosis can often be strongly suspected in appropriate epidemiologic setting. For example, when you have several cases occur in localities, so you can suspect an outbreak, or in setting with a risk of water contamination, you can also suspect hepatitis E. And when the disease is more severe in pregnant women, you can also suspect hepatitis E, especially if hepatitis A is excluded. Definitive diagnosis is usually based on the detection of IgM antibodies, anti-hepatitis E, and from the blood. And this is usually adequate in areas where the disease is common. So you can do rapid tests. But additional tests include reverse transcriptase PCR, RT-PCR, to detect hepatitis E virus RNA in the blood and even in the stool. These can be used to try to confirm the diagnosis. But this is how the serology is done. Those are the duration in weeks following exposure. So you can see that 2 weeks following exposure, that where you start seeing in yellow, it's a IgM, that's antibodies that start increasing. Then here you have the total IgG, anti-hepatitis E. But around between 2 and 3 weeks, you already found the virus in the stool that is there. And the liver enzymes are the one that starts increasing early, the ALT. So you can see early on following exposure, the major thing you can observe is the change, the increase in the liver enzymes. So the ALT starts increasing even before that you can see the antibody, the IgM anti-hepatitis E. And here you have your clinical manifestation, during the initial phase and the second phase when the patient will develop jaundice. So this is how you make the diagnosis of hepatitis E. So how do we treat this? There is no specific treatment capable of altering the course of acute hepatitis E. As the disease is usually self-limiting, hospitalization is generally not required. So most important is the avoidance of unnecessary medication, okay? These drugs, acetaminophen or paracetamol and the medication against vomiting should not be given to this patient. They might make the condition worse. However, hospitalization is required for people with fulminant hepatitis and should also be considered for symptomatic pregnant women. Remember, we say that in pregnancy, the condition will be very critical. Immunosuppressed people with chronic hepatitis E will benefit from specific treatment using ribavirin, that is an antiviral drug. And in some specific situation, you can also use interferon that can be successfully used. Prevention is the most effective approach against the disease. At the population level, transmission of hepatitis E can be reduced by maintaining quality standard for public water supplies and establishing proper disposal systems for human feces. So those are the major way for preventing the condition. Then on an individual level, infection risk can be reduced by maintaining hygienic practices, avoiding consumption of water and ice of unknown purity, avoiding drinking water and beverages with ice of unknown purity, uncooked shellfish, and uncooked vegetables or fruits that are not well washed. In 2011, a recombinant subunit vaccine was developed to prevent hepatitis E, but this is only licensed in China. It has not yet been approved in other countries. And there is an unknown efficacy of the immunoglobulin prepared for donors, from donors. So in conclusion, hepatitis E is a liver disease caused by infection with a virus known as hepatitis E virus. The virus is transmitted via fecal oral route, principally via contaminated water. And a vaccine to prevent hepatitis E virus infection has been developed and is licensed in China only, not yet available elsewhere. So thank you very much for following our lecture series on hepatitis. We actually had this lecture in 6 parts. We have an overview of viral hepatitis, then we discuss hepatitis A, B, C, D, and hepatitis E. So if you missed other lectures, please go in our channel and you will find the rest of the lectures on viral hepatitis. Thank you and goodbye.